Methodist Hospital. The CDC warns more than 1,000 Americans are dying each day from COVID-19, so the race continues for effective treatments. New results show patients had a 9-fold chance of survival and recovery from respiratory failure after being treated with Aviptadil, also known as RLF-100.
Aviptadil is a fancy name for synthetic vasoactive intestinal peptide, which is also an intimidating name. The important thing to understand is this is a tiny bit of protein. It's 28 amino acids long that all air-breathing mammals have been making for as long as mammals have been breathing air in order to protect the lung from all kinds of injuries.
Dr. Jonathan Javitt is leading the trial of Aviptadil. He's with Johns Hopkins University and NeuroRx. He says doctors have been trying to figure out why COVID-19 knocks out the ability to get oxygen from the air into your blood.
And we now understand that the reason it does that is because it knocks out the cell that creates the critical fluid layer that lines the lung. Without that layer of fluid, human beings are like a fish out of water. They can't exchange oxygen with the outside world. The oxygen doesn't get into the blood. And that's what kills you in COVID-19.
That's why the goal of this new treatment targets the lungs.
And this peptide, which has been around in nature for either 65 million years or since an intelligent creator designed it, whichever belief system you have, this peptide protects that very cell. It binds specifically to receptors on that cell. It doesn't bind anywhere else in the lung. And when it does, it blocks the ability of the virus to copy itself, to replicate. It increases the lung's ability to make surfactant. It blocks these inflammatory cytokines that everybody talks about. And we believe that that's why we've seen these dramatic improvement in chest x-rays.
You can see the difference here in these x-rays before and after treatment. Dr. Javitt says so far, even the most critically ill patients are improving in just a matter of days after treatment.
Well, we're starting out using intravenous Aviptadil in the most serious patients, the patients who are in ICU, either on the ventilator or getting high flow nasal oxygen. But our plan is within the month to start a second trial using inhaled drug in the people who are much less sick, people who are not in respiratory failure, in the hopes that we can keep them out of the ICU.
Dr. Javitt says that's a similar concept of how asthma drugs treat patients. Another promising thing about this treatment, peptides can be manufactured synthetically in huge quantities and relatively inexpensively. Now, if the FDA approves this treatment, Dr. Javitt said 30,000 doses could be ready to roll out by March, and then many more on a regular basis after that. We'll keep you updated as soon as we hear more news about it.